I've been giving this topic of ADHD, Attention Deficit Hyperactivity Disorder, myths and facts. The very existence of this disorder is a dilemma. A lot of people, even in this room, I had a talk with few of the parents. They said it is a gimmick, a commercial gimmick, which has come into existence because of the pharma companies. So, I will first prove in that it does exist. After this, we will deal with other myths with it. So, starting with the very first existence. I know you won't be able to read much of it. Just pay attention to the colors. So we started with in 1776, 18th century, when somebody thought something is wrong with the children. Pharma was nowhere around. All the blue colored pictures, it is the pre-diagnostic era. All the work which has been done in the pre-diagnostic era. There were reports coming in from different part of the world where they used to describe the features. Nobody was knowing what basically is what, how to label that, and there was no diagnosis to that. There was just a symptomatology, a conglomeration of symptomatology which was put across together starting in 1776. So, the first paper, the second one, which came in 1796, Crichton, he described exactly the same features as now which we have in DSM-5 criteria. So, he described a lot of inattentiveness in children, which we will just compare that we have the criteria in DSM now and the previous features which he described in his papers. And then coming on, there were a lot of people who described this similarly picture of the children who were not sitting in. There was a lot of hyperactivity, impulsivity. There was less attention to whatever was provided to them and more attention to the external stimuli which were there. To name a few, there were Hoffman, there was Bradley, there was Kramer. A lot of people describe this all. And then after that, just focus on the pink color. So pink color was the time when a lot of description had come in and they thought, no, this is something is wrong somewhere. Let's not think as something as this as psychological and put some pathological reasoning to it. At this point also there were no medications. So the pink color, all which you see is basically ADHD-like symptoms were described and were associated with minimal brain disease. They found out a lot of children who have hypoxias in the early period of their life, in the neonatal period, perinatal period, they were very anxious, very hyper, the concentration was not up to the mark, and so they described this and correlated with maybe they have some minimal brain disease even though their MRIs were absolutely normal. So they described some minimal brain disease is there which we are not able to see on an MRI brain of 1.5 Tesla. That was the time of 1.5 Tesla, and still there were features. So, and then after that in the year 1950, US FDA approved some medication for depression and narcolepsy, which is nowhere near ADHD. So the first existence of medication which we use commonly now for ADHD came in for narcolepsy. The first FDA approved came in for narcolepsy and depression. And so everything was put into the thing, because the same medication which is given for narcolepsy and depression, how can I give it for my child who just has plain simple case of ADHD? And so the fight started at this point of time. Then DSM-3 came in, that is Diagnostic and Statistical Manual. I just want to know how many of you understand what I'm talking about. Would you understand DSM-5? because then I'll explain it more further. So a lot of people understand what is DSM-5. DSM-5 basically is Diagnostic and Statistical Manual, which when came in is basically the Bible of all the disorders, where you describe in the disorders, put in all the perspective and the guidelines to diagnose a child like autism, like ADHD, depression and other things. So, and in 90s, 80s, somewhere, that means in the 19th century, we started from the 18th, 100 years it took to find out, okay, this is not something just minimal brain disease or something just nothing to do with mild minimal features of inattention. It is something. And so they published their first data in 1980. Okay? So, and then came in the era of the medication, omega-3, people started peeping up into the thing, no, this is an entity, how to work upon that, behavioral sciences came into thing, and now in 2010, we are into the molecular genetic diagnosis of this. So, a lot of water has flown below this. This slide just proves this, so that ADHD do really exist, because even before the pharma company came in with all their medication, there was something which was well described in literature in the 18th century which says, yes, it is ADHD. Now let us compare. What did they say and what are we believe now? Description. So, he was a Scottish physician and his name is Alexander Crichton in 1798. What he said was, when an object of external sense, something happening outside his body or of the thought, occupies the mind in such a degree that he is unable to perform the work given to him. So that is what? That is inattention. I am very much open to whatever is happening outside. I have everything, even when a pin falls, the noise of that really causes distraction for me when I'm studying. A small door opening can lead to a lot of distraction, even when I am like my hand and everything is tied on and I'm asked to focus. So this is how we describe inattention now, and this was Crichton described there. He emphasized that the intensity of healthy attention varies with a normal range in the same individual. So a few of the parents say, Ma'am, he watches television for hours together, and no matter what happens in the surroundings, he is very much focused into what he is doing. Whenever the thing what he is required, he is doing. That means he has a passion for television. He will watch television for 4 hours or 6 hours together. But now this has been proven that whatever focus he is having, the amount of interpretation of those things is not the same as a child who is neuroatypical and he is focusing for 4 hours. A child who has been diagnosed with ADHD will not get the same amount of information transmitted to his brain, and the processing would be done is inequivalent to a neurotypical child who does not have ADHD. So you feel that he is very much interested, but the information going is not that great. So a distraction of attention does not necessarily has to be pathological, and education and can have a great impact on healthy attention. That means he gave this information that in spite of being inattentive, it just cannot be any pathological reasoning to it. You can have psychological reasoning, or you can just add us to a conglomeration of symptoms with a normal MRI, with a normal EEG, with normal metabolic testing, and maybe normal genetic too. Then he said, he distinguished 2 possibilities of abnormal attention as the oppositional poles of pathologically increased or decreased sensibility of the nerves. So basically at that point of time when the MRI was not that great, MRI was not there, so he put it, something is there wrong with the nerves which is providing a wrong information to the brain, and the attentiveness and the concentration is not that great. So this description in the 18th century is what we have describing in now into 2020 for the ADHD. So again, he said the same thing, that difficulty sustaining attention in task or play activities. So he won't be able to adhere to one thing which is required for hours together. And this faculty is incessantly withdrawn from one impression to another. That means I do this, after 5 minutes I get bored with this, I put my attention to this, I get bored with this, and slow, I'm a flickering attention. And this is what we called as the same in DSM-4 TR. So, also he was so smart. I was looking into literature, and the people in 18th century, he said his observation was so good. The symptom have to be present before the age of 7. This is what we say in DSM-4, and now with DSM-5 we say till 12 years, before 12 years. And similarly, he also reported that the disorder can be born with the person, and when born with the person, it becomes evident at a very early period of life. So this gives the interpretation that yes, something genetic is there, and we have to, and that is why we are putting a lot of effort into genetic explanation of all these things. So all these, a lot of research work is going on to find out the genes responsible for ADHD. So this was in 18th century. So he put it that something is there which is the child is born with. You pick up the symptoms later, maybe it is your fault, but there is something. If you observe the child early in his years, you will find that something is wrong there. The proximate conclusion, it renders him incapable of attending with constancy, and because of that, there are school difficulties. So he put it across that yes, a child who has ADHD can have school difficulties. Then it is generally diminished with age. And also we are the same stage. At 50%, we know that now that 50% of the children with ADHD, just at the passage of age, becomes better and maybe lose their title of ADHD. So this was the explanation which was given, and now after so many centuries, we are the same there. A bit here and a bit there, a bit more on the genetics, we are doing that much, rest remains the same. A lot of definitions of DSM has been changing, like in DSM-4 we put up the age limit before 7 years, and whereas in DSM-5 we have put it 12 years. It's because just to get a good data, because the data was not collected, because sometime a child was diagnosed at 8 years and he was not into ADHD because the age criteria was 7. So, just to get a good uniform data from all over the world, that's why these DSMs changed these criteria a bit here and there. So, now, let's come to you all. How many still believe that ADHD isn't a real medical condition? Are there any people around who say, no, my child is just a bit hyper, that's it. Every child at this age can have, I don't have any concerns with the child, apart from that he just disturbs the class a bit. So do you all agree that ADHD is a real medical condition? I don't. Wow, okay. So can we have the reasoning? Because I put it across so much, I thought I will be able to have 100%. Anyways, so we can discuss later. ADHD is a result of bad parenting. Do you believe that? Because a lot of parents come in, maybe I'm giving less time to my child, I'm working, I just give 3 hours to my child, and that's why that has led to this type of things. He's not interested in the studies, and he's the crutch, or he's in the daycare, they are not giving full facility, and that is why mothers especially come in and say it's because of wrong parenting. I've done something wrong by working and not paying attention to my child, that my child has landed into this distress. No, this is not there. ADHD is a real thing, and it is not a result of bad parenting. Even if you sit with your child 24/7 and still he can have ADHD. Okay? Any concerns on that? Myth 3. Kids with ADHD just need to try harder to pay attention. mean, he plays so well. He is cling to television so well. He takes in mobile. He knows the functioning of mobile very well. He knows the functions of the object very well. He knows how to talk very well. So it's just because his mood. He just don't want to read. He just need a corporal punishment or something to get him his attention. Doctor, can you just guide and just give him some psychological advice so that he listens to that? No, this is a myth. He really has the attention concerns. So every day we deal with one or the other parent who comes in and say, just give some counseling to my child and I think he'll become normal, he will just start studying. I don't think so. He is so good in his brains that I don't see anything in which he is not able to perform. In fact, a few days back, we have like 4 children coming in together in the same complaint, and the mothers were like, just give counseling to our children and I think he will be fine. So no, it is not the counseling, it's the counseling of the parents who needs to be done and not the child to get into the real situation. Try to understand your child. He is really suffering from it. He doesn't understand what you are doing, what you are saying. Even if he is focusing for 4 hours in whatever he is doing, his attention is not there. He's not gaining a lot. So just try to understand this is a real scenario. ADHD is reality and help your child in that. So kids with ADHD can't ever focus. They can, but with obviously some help. All kids with ADHD are hyperactive? No. And there comes the scenario where they say the data suggests that in males, ADHD is 4 times more as compared to in females. But recent studies are getting into the thing that it is 2:1. Because girls generally don't show hyperactive nature or impulsivity, they show more of inattention to it rather than impulsivity, and so they are not picked up earlier, they are picked up very late, or maybe is considered some other symptomatology or some other diagnosis rather than ADHD. So it is possible that all the children with ADHD can have a bit of inattention and a bit of this. So they could be mixed type, they could be purely inattention type who are just sitting and daydreaming. So those daydreams are nothing, just inattention, spells of inattention, and that would be very well dealt and taken care by the ADHD diagnosis. So I think I've covered this point. Only boys have ADHD? No. Now people have come across that girls also have the same thing, but the symptoms are different. Now comes the big question. I was given this thing that I really have to cover up this topic. Medication is the only way to treat ADHD? So, medication is not the only way to treat ADHD, but it is also one of the way to treat ADHD. What does the guidelines say? Guidelines say children below 6 years of age, you can try with a lot of therapies, including occupational therapy, behavioral therapies, but if the symptoms become beyond that and the age crosses 6 years, the first line of management is medication. I just met one parent who said, I just don't want to give medication because this causes this. But without trial, how can you say? How many parents have tried ADHD medications? Why not a lot of them? Just a few? Do you really feel it made the difference, or it just made your child dull and lethargic and anesthetized, or landed up into cognitive delays and all? So I am here to break this myth. I'll give you the science behind that and I'll give you the reasoning behind that. I'll also listen to you, but I'll speak more than you. Yeah. I'm not able to hear you. I have to open up the mic. Okay, in the meanwhile.
Hello?
Okay.
It's what? doctor saying if I'm giving him ADHD medicine, some hormonal change can happen to the boy, and the upper part of the body, that is breast, will increase in size. So that made me scared to give the medicine to the boy.
Okay. I don't believe this. I don't know from where this literature has come in. That's called as gynecomastia. That's called as that can happen, but this is nothing to do with this. I'll deal with that. Let's do the side effect later on. Let's do the myths first. So, many people believe that ADHD is learning disability. No, ADHD is very much different, and learning disability is totally different. Okay. I think we'll have the questions later on after I finish, because then it will create a lot of chaos. Okay. Okay. Yes, please, sir.
If we don't keep the child occupied, he becomes sluggish. If we give this, we give him my son.
So it's not the dose, it's the dose. Then taper down the dose, decrease the dose.
Not the dose also. Not the dose also. We have to keep him occupied. If he is not occupied, and if we give him medicine, he becomes sluggish.
Okay,
sleepy
I'll answer to your question later on.
Yeah.
Okay, I'm keeping the thing. I'll answer all the questions. So ADHD is learning disability. No. Learning disability is totally different, and that's a very basic question. ADHD is totally different. I put up this slide because I was asked this question, but this is very basic. So, kids with ADHD will never outgrow it. So this is proven now, 50% of them can outgrow it. Okay, 50% remains still, and they can present as in the form of suicidal tendencies, depression. The symptomatology changes. They are not hyper. They may sit there in the on the chair. They may not move around when they are 20 years old, but they have very less attention. They may be fidgety. They may have depressive symptoms. They may not feel good in others' company. They land up into OCDs. So, I mean, the symptomatology changes, but it's still there in 50% of the children. So these two books are basically the culprit which provided with a lot of bad information to the journal society. ADHD does not exist by Richard Saul and ADHD Nation. Basically, it was for US. They say that 1 child in every 7 children was labeled as ADHD, and it's because of the commercial gimmick that every child, like out of 1 in every 7 child is like quite a big number. And then this book came in, and people were totally against the medicines, and there was a big lobby, like anti-vaccine lobby in autism stood up. So something like this stood up in whole of US, and also it's penetrating to our country also. We are also a country of homeopaths, and quite abhorrent for allopath, I know. But this also put a lot of effort in creating ruckus in the society. But if you go through these books, anybody of you have gone through this book? If you go through this book, ADHD does not exist. In the last pages of the chapters, he has displaced the term of ADHD, but the symptomatology which he has given and giving us another term, he has described the same symptoms of ADHD. And he puts a lot of differential diagnosis in his cases, and those cases who were wrongly diagnosed as ADHD but something else. So I'll also go through what he was put across. So we'll leave this slide and come to the differential diagnosis first. So these are the differential diagnoses which he has quoted in his slide, in his book of ADHD Does Not Exist, and this is the work of every doctor, that we should rule out these before putting in the diagnosis of ADHD. So these are the differential diagnoses. Number 1 is mood disorder, major depression, hearing loss. A child who's not able to hear can be very inattentive because a major sense organ is not working for him. So always rule out the child has hearing is very good with him. Vision problems. A child who's 3 years old, he cannot tell you, I'm not able to see the word clearly, because he thinks that this is how the word looks like. Blurred, and also because the word appears to be blurred, he starts manipulating. He wants to be happy, so he starts doing some work which you feel like these are stereotypies. And because he's less interactive, he's lost in his own word. So a PAL checkup to check in for the refractive error, for the number, should be always done before you label a child with ADHD. Third is substance abuse. Fourth is hyperthyroidism. That is also not that uncommon. a child who has a lot of hyperactivity should be tested in for the thyroid hormone. Sleep problems, as Dr. Shefali has already put in across, if you are not having a good night's sleep, you may be very cranky the very next day and you can land up into a symptomatology of ADHD. Absent seizures, please make sure this is always ruled out. In absent seizure is the very closest differential of inattention. Sometimes we also get confused. A child will just be staring episode for 2-3 seconds and then come back and he'll lose the context and slowly his marks and everything will go down. So EEG is a must before you make sure, if you're 100% absolutely sure of, else if you have any doubt, please do an EEG to rule out an absent seizure, because the symptomatology is the same as the ADHD symptoms. And then learning disability. So I have my time. So myths, I have to deal with this. ADHD treatment is dangerous. No, it's a myth. I'll disclose you one thing. The top shot pediatric neurologist of India, 2 top shots, their children are on ADHD medication and they are doing beautifully well. This is a disclosure. Okay? So if a pediatric neurologist can put their own children on those drugs, I think that we are safe. So ADHD treatment is dangerous? No. ADHD is overdiagnosed or overtreated? No. If you have ruled out all the other differentials and you're quite sure you have met in the symptomatology, this is there. ADHD usually gets better or goes away in adolescence. They can grow, but only 50%. This is the time for you to treat. If the child is struggling with that, he's having conduct disorder, he's not getting good grades in the class, he's landing him into depression, you are not supporting him. No, he can be worse with the passing days. ADHD medication work by stimulating something in the brain. No, not stimulating something. It just changes a bit of the hormone level, not the sexual hormone which causes gynecomastia, which one of the madam disclosed. It is an imbalance between the hyperhormones and which brings you down. It's just the balance between them that we are doing and behaving like this. And these anti-ADHD medication just brings a balance. They don't cause a hormonal balance. Hormones are totally different thing, and something working in the brain like serotonin and other things, those are totally different thing. Norepinephrine is totally different thing. ADHD medications are just for speed. You just want your child to get back, kick back, you give ADHD medication. No, it is not the same case. Stimulant class medication cause sleep disturbance. No, if you give it at the right time, if you're giving it 8 o'clock at night, definitely it's going to cause the sleep disturbances. It has to be given early in the morning after the breakfast. ADHD medication cause a loss of body weight. Yes, it can, but it only causes anorexia for the time by which it's showing its effect. That means if you want the medication to work till 4 o'clock, he may be a bit anorexic till 4 o'clock. He can bring back your tiffin which you have given in for the school. But as soon as the effect of the medication wanes off, the side effects also wanes off. And you can have a very sumptuous dinner for him. So all those children who are taking this, I do believe, yes, anorexia sets in, loss of appetite sets in, but you can recover that in the dinner time. Give him a lot of food in the dinner time and he will have the normal appetite. So it cannot cause weight loss. ADHD medication cannot be used by a person who have seizures? No, we use it very frequently and there is no concerns with that. And it can worsen tics? No, tics and ADHD are like hand in hand. 50% of the children who have ADHD can have tics. So it's not the medication, it's the journal in disease, the sequence of the disease which is causing the tics and nothing else. It's not the ADHD medication. And sometimes a lot of people use the cheaper generic medication which is just as good as the expensive time release product. No. If you just slowly release the medication, it will work for a longer time. Sustained release are much better than the small release or the one which are generically provided. So if you're giving your child a medication for the ADHD, make sure it's from a good company and not from a local generic one. I think my time is over, so let's start with the questions if you have. I wanted to discuss this, but maybe we'll put it if the time still's there and the questions are all met. Anybody for the questions? Okay. Well, I'll cover this up. So there is no role of omega-3 fatty acid. Just last line.
Ma'am, I want to ask something.
Okay.
I have a 5-year son, and child neurologist subscribes Cizodon for him.
Yeah.
Yeah, in morning I just gave 0.5 mg to him, and after some time his OT teacher complained that he is very low. He's not.
So give it night. Give it night. So there are two groups of medication which can be used as ADHD, FDA approved. One of them is stimulant, which is methylphenidate, and the other one is atomoxetine. Those have to give in the mornings only. Whereas risperidone, which is like Cizodone, which you are telling, definitely causes sleepiness. So you can give it at night so that he sleeps good night sleep, and then he gets up in the morning. The side effect of the medicine has waned off, and the effects come in, and your special educator does not complain of this.
Oh,
so
okay,
that's the science behind it. You should know what you are giving. That's why you should
for
consult the
night,
doctor.
she subscribed Melocet for him.
Melatonin is totally different medication. Melatonin, you, I, everybody, it's a normal simple hormone. Whenever we close our eyes, melatonin is secreted. Whenever I have like travel deficits and I want to sleep, I take melatonin with me. So melatonin it's just for the sleep initiation. In fact, melatonin does not cause prolongation of the sleep. Just for the sleep initiation, melatonin is given. Risperidone is totally different from melatonin.
Okay, thank you, ma'am. Thank you.
And melatonin does not have any effect on ADHD. That's very different medication. That is just for the initiation of sleep. All those children who are not having good sleep, in the initiation part of it, you can have a melatonin 3 milligram, 6 milligram, 9 milligram is the maximum dose which you can give. It's not dependent on the weight, and you can have a good night's sleep and a very good morning. Anything else? So all those children who are, all those parents who are feeding their children with a lot of omega-3 fatty acid to just curb down their ADHD manifestation, this is a 50-50 thing. FDA also has not approved, and a lot of studies have shown a bit of the improvement, but rest of them say it's of no great use. So it's up to you that you want to give. Rest, it's not of much significance. Similarly, with the role of sugar and physical exercise, sugar definitely increases the inattention and hyperactivity, but how it is associated with ADHD from the birth, nobody knows. So definitely we tell our parents you can stop or decrease the sugar concentration in the diet as much as possible, and definitely physical exercise helps you in concentrating. This is a normal thing which we all do. So there are a lot of people who have ADHD and who really found success more than you and me who are neurotypical. And a good example of is Michael Phelps. Basically, he is the one who has won the maximum Olympic gold medal in swimming. And he claims very specifically that at the age of 3 years, her mother thought there's something wrong. He has a lot of energy, and he put him in the pool. And now he is the Olympic medalist, highest tally. So I mean, all those children who have it, you can try sports, and your children can really excel in that because they have a lot of energy, and if that's channelized, nobody knows that I will be adding your child's name in one of the slides. Okay, thank you.